We're glad that you decided to spend an hour with us this evening. As parents of children and young adults and adults with disabilities, we know how valuable your time is. So thank you for sharing some of it with us tonight. We are here for Transition to Adult Healthcare, a parent's perspective. And I am Alyssa DiFilippo, the program manager for Parents Helping Parents program called Connections California. If you are new to our Connections California series, welcome. If you're a repeat viewer, thanks for coming back. And you would know then that Connections California is an online statewide resource and information hub for transition to adulthood and adult services. And normally I host events where we bring experts and professionals in to share their wisdom with all of us. But this evening, as part of our Parents Perspective series, I will be your presenter this evening, talking about my journey with my 26-year-old daughter on her pediatric to adult care healthcare transition. And I feel as if even though she's 26 years old, we're still kind of in the middle of transition to adulthood. So I'm learning right along with everyone else. So as I said, this webinar is our personal story with Grace, and I've cleared with her that I'll be sharing our story with you today, and she's just fine with my doing so. You'll be hearing my point of view, though, which in no way means to diminish Grace's role in this or any of our young adults' roles in their transition to adult health care, because it's essential that they are engaged in the transition. But the focus today is about us, the parents. I'll be providing some practical tips on how to approach transition to adulthood, both for parents and for the youth, and also a bunch of resources. I love resources and I love sharing them. So this is a resource-rich presentation and just a high-level overview of health insurance, public benefits, and decision-making. And then we'll just touch a little bit on how to let go to let grow. So as parents, we may approach just about everything having to do with our kids' disability, or some of us might, with a certain amount of fear. You know, we could be scared about things, especially when considering what our young adults' life is going to look like once they leave that school environment. There's so much to know with switching systems of support. And depending on the individual circumstance, we could be considering things like a change in public benefits, maybe some IHSS, SSI, SSDI, legal decision-making after 18. Maybe there'll be some Department of Rehabilitation connections being made, and regional center services and programs are going to change. Housing, that's a huge one, and other independent living options. Will there be any more schooling in your young adult's future? A technical school, an inclusive program, the self-determination program through the regional center. I mean, it's a lot. It can make your head swim. It can make you pull your hair out as it grays organically. And for me, one of the scarier pieces of all that is transition is the healthcare piece. So please allow me to tell you why. Meet Grace. Always a bit of an imp, no stranger to doctors, therapists, hospitals. She had a blood transfusion within hours of her birth and an MRI at 3 days old. 3 clubfoot surgeries, several sleep studies, a tonsillectomy, biofeedback therapy for intestinal muscle awareness, which I can go into details if you'd like me to, but you probably don't want me to. Physical, occupational, speech, vision therapies from a very young age. I think her first PT physical therapy appointment was at 6 months, all the way through her early 20s. She spent more time in clinics at UCSF, University of California, San Francisco Medical Center, than on playgrounds. And she always approached any adversity with pluck and determination. And she is so much more than her diagnosis, which is Prader-Willi syndrome. But let's face it, it is a defining part of her life, and it is a complex and challenging disorder. Some characteristics, common characteristics include abnormal growth and body composition, very small hands and feet, very low lean body mass, hypotonia or weak muscle tone at birth, failure to thrive in the early years, meaning they don't gain weight very quickly. I remember taking her to the pediatrician every week to weigh her on the same scale because, yes, I'm a little compulsive myself. And by about 4 to 5 years old, an obsession around food, eating it, talking about it, planning for it, and a hunger, and the potential for obesity and all those medical needs that come with obesity may start rearing their head. If she's not, she's on a very low calorie, low fat diet. She calls it her healthy diet. And there could also be learning differences, mild to moderate to severe intellectual disability, depending. So PWS is due to a dysfunction of a portion of the brain called the hypothalamus. And the hypothalamus is a small endocrine organ at the base of the brain, plays a crucial role in bodily functions, including regulation. So it regulates hunger and satiety, body temperature, pain, sleep-wake balance, fluid balance, fertility, and emotional control. So it sounds like a lot, right? And it is. But you add to that 26 years ago, and maybe even now, most doctors had maybe read about it or heard about PWS, Prader-Willi syndrome, in medical school, but that's about it. And not that that's a failing for them. And this is a rare disorder. I think maybe I might not be right about this, so don't quote me, maybe 1 in 20,000 people. So it's rare. But we were put in the position, as I'm pretty sure some of you are, of educating the doctors, the very professionals that you're going to help with for the condition. So it hasn't been an easy road. And then I realized, and then you may realize too, right about the time when other transition to adulthood concerns start rearing their heads, that we're going to have to change all of Grace's medical providers, her general practitioner, her endocrinologist, her orthopedist, her physical therapist, her podiatrist, her gastroenterologist, her proctologist, her psychopharmacologist has been her only consistent provider since she was about 12. And then you have to start that education cycle all over again with a whole new group of specialists. And we tried to have that go from anywhere from when she was 19 to 22. And so that's what we've done. It hasn't always been easy. We weren't always successful, but we are pretty stable right now. So we're going to talk about where we were, where we are now, and where we're going. So about 3 or 4 years ago, everybody was coming out of COVID a bit, time to venture out to appointments, though we were getting used to those telehealth appointments, those visits, I'm not going to lie. And, I wish I had the magic formula to share with you about how you get referrals and specialists and a GP in your area who actually understand what it is to work with an adult with a developmental disability. But I don't. I don't have the magic formula. So we ask for referrals from all the specialists. Specialists seem to be easier to find than general practitioners in the county we live in. We live in Marin. I don't know if that's what it is in your counties, but let alone someone who knows how to work with adults with developmental disabilities. But we live in a world where we have information at our fingertips, right? So I read reviews, I got opinions, and I researched the referrals. But the main thing is asking other parents, the parents helping parents, right? So if you belong to a support group, Parents Helping Parents has the PACDD support group, Parents of Adult Children with Developmental Disabilities. There's a closed Facebook group. They meet every month. And it's been a really great source of any kind of adulting information. But also you can check out the Parent Training Information Center, or PTI, or the Family Empowerment Center, or FEC, that is in your area. Several of our sister organizations run support groups as well. And you can find your PTI or FEC at the end of this presentation, I have a bunch more resources, and you can click on those maps and find your PTI or FEC. So there were some handoffs and first appointments that happened during COVID, and some virtual meetings. You know, at virtual meetings, you can't always tell a lot. So we were successful, some we weren't. But then once we landed on providers, you had to coordinate the transfer of all those medical files. And we're talking 6 to 8 inch thick files with all those specialties. So some of that information hadn't been scanned yet. So thank goodness I saved everything, to my husband's dismay. But Dr. Spinazzi, who is the medical director of Charlie's Clinic at UCSF Benioff Children's Hospital in Oakland, and I had the pleasure of presenting with her at a Family Voices conference last year, she gave us this tip, and that is to recommend having the pediatrician or the pediatric specialist write a comprehensive last note with a summary and directions for the adult doctor. That way, the adult doctor doesn't have to go through the whole thick file. Her point being, will they really do that? And the question is probably not. So I wish I had known that, and I'm really grateful that I'm able to share that with you in case you are not yet at that point. One of the first websites, the first resources we went to is something called Got Transition. And if you don't know Got Transition, it's a resource that includes parent and youth health transition timelines, questions to ask doctors about transitioning to adult health care. They have a healthcare transition readiness quizzes for parents and youth. And I'm just going to bring you there and take a little gander. So here's the Got Transition site. You'll see it has 6 core elements for clinicians, youth, young adults section. Actually, let's go to the parents section, because as I said, this is parents' perspective. So let's go to the parents section. And it talks about what healthcare transition is. Is everybody ready to go? Here you can take the quiz. Now, the quiz, it's not scary. It's, I think, about 6 or 8 questions, and they're all in this kind of very easy to find form, and except it's not here. Okay, well, let's just go back to here and find out why it might not be. But I can show you on the next page, actually, what it looks like, because just in case I had some problems with the internet, I decided to take a picture of it. So this is what they look like. They're a picture with little questions underneath. Do you see a doctor that sees adult patients, or a doctor who sees only children? So that's something that you might want to ask, that the youth might want to ask the youth. Does your child know what their healthcare privacy changes at age 18? That's a question for a parent. So it's very sort of good to just tiptoe into a kind of resource quiz. Nothing scary. They do have other things like this health transition timeline, which kind of has ages down the side and what you might want to be doing at that time. And then some questions that you might want to ask the providers about adult health care. So this is a wonderful resource. Another resource that I really like is from UCSF, called the Office of Developmental Primary Care. And they have a number of different resources too that I really like. Is this Getting Ready for My Visit, which is a form that you can go over with your young adult or adult and have them fill it in. Then there's also the follow-up from my visit. So you can get used to, and they can get used to, oh, I might have some questions before I go, but then I might have some information after I go, and I'm going to need to remember it somehow. So maybe I should write it down. So I like other resources from the Office of Developmental Primary Care as well, which I will show you here. But first, let me tell you about PACER. PACER is a parent training information center in Minnesota, and they have the National Parent Center on Transition and Employment. They also have videos made by youth for youth about taking charge of my own healthcare And then they have some healthcare transition tips for the pediatric provider and medical transition for your child with special healthcare needs, a tip sheet for parents. These are two of their newer resources. And that's written material. But it's a wealth of information on this site. So I would recommend that you go visit that as well. Then at the UCSF, again, the Office of Developmental Primary Care, they have a guide on sexuality and sexual health, which is wonderful because it's accessible for those with developmental disabilities. We looked at some of the tips for organizing visits. They also have tracking forms, which I can bring you to those if you'd like, that you can do behavior, bowel movement, daily living skills, medication administration log, menstruation chart, seizure tracking chart, sleep log. I mean, it's just a nice way to be able to, well, that's really small, but it's a nice way to be able to track things in logs, as it says. Very I don't want to say basic, but it's relevant information, and it's a good way to capture it. Also, they have a really good advice from self-advocates. So if that's something that your self-advocate might want to take a look at, I think that could be beneficial as well. This last one here listed Life Course Nexus tools. Life Course Nexus describes itself as a community of learning designed for people with disabilities and their families or caregivers. And this is the newest resource for me. I haven't fully explored it yet. But the framework and tools help to organize ideas, vision, goals, as well as problem solve, navigate, and advocate for support. So what they do is they separate the resources into different life stages. So birth through aging. And then they have sections or domains is what they call them, like daily living, employment, caregiver well-being, supported decision-making, and then healthy living is one of them. And they take the point of view of the person with the disability, though the resources, some of them, are not in what you would call plain language. But they're working on that, and I'll tell you in a minute what they've done. But so this is the question book. You can see a lot of text here. The timelines are across the top: transition, adulthood, aging, and then healthcare as being one of the domains. But I can have us jump into this for a moment while it loads. So you'll see that there's a lot of text on a lot of pages. And maybe it's a little bit too dense. Maybe it's a lot of words for me. So here's about the guide, navigating the guide, and then here it starts with prenatal infancy, early childhood, school age, and this is the education section. So it goes all the way like that, for 20 pages. So personal safety, I mean, you get the idea. But what they have done, which I heard about last fall, and I'm so happy that we're almost to the point where all 6 of the transition to adult healthcare toolkits are completed. There are 3 that are completed. They're in plain language. Again, they are healthcare transition toolkits, and I'll show you exactly what they look like. I hope I'll show you exactly what they look like. There we go. So healthcare transition to adult healthcare with confidence. I love that. That's a great title. It tells you what a toolkit is, how it has a side-by-side guide, an easy reader, a tool, and then a tip sheet on how to use that tool. And let's just go into toolkit 1, which is ready and available, understanding healthcare transition. So here's the side-by-side guide. So kind of explaining who it's for, how it's going to, for supporters, how you use the guide, what is transition to adulthood. So this is a little bit more accessible, yes? But, and then I like this, this down here, this chart, see? my healthcare as a child and a youth, my healthcare as an adult. So if you'd like to see something that's even a little more accessible, this easy reader, which I think is a wonderful, wonderful resource for our purposes. So it actually just has pictures with just a little bit of text. When you were young, healthcare when you were young, what do I need to know? What is healthcare transition? What does transition mean? What do I need to know? So it's a very accessible form of getting information to the self-advocate. Then they have a tool that enables you to fill out a form and tips on how to fill out that form. So all in all, I can't wait till all 6 are available and to be able to explore them all. I think that it's an incredible resource, and I'm very grateful to Life Course Tools for presenting them. Now, we're going to leave the world of transition resources for just a little bit and delve into everyone's favorite topics. Health insurance and decision-making and public benefits. Oh my, like lions and tigers and bears. Oh my, this is health insurance and decision-making and public benefits. Oh my. Let's tackle private health insurance first, medical, dental, and vision. So the world of health insurance is a wild and wacky one, and I am by no means an expert on it, but suffice it to say that there is a way to keep your 26-plus-year-old on your health insurance policy through your work. You need to check with your employer or your human resources department. And also, while you're checking, check about the extending the dental and the vision coverage as well. As I'm speaking, I am reminded that I need to do that myself by March 15th. I need to get my form in. If your employer needs any information on this, there are some links that you could go to and share with them. And, they may not support it, but they may. So it's not a bad thing to ask if you'd like to. Now, once your youth is over 18 years old, the law looks at them as an adult, right? So you'll need an assignment of authorization information form. Each insurance company, I think, has their own. I attempted, I'll talk about conservatorship in a minute, but Grace is conserved, and I attempted to send conservatorship papers to the health insurance company, and they really didn't want those. They wanted this one form. So I think it has to be updated yearly, and it took me a while to do it, but it was a lot better than calling and trying to talk to the insurance company, and Grace would be out. So they'd say, is she there? Is she okay with you talking? No, she's not there. Okay, we can't talk to you. Or having to run downstairs and get her to say, yes, it's okay that you talk to my mom. So either way, having this form kind of covers a multitude. Now, health insurance is a world that really frustrates me. I recently spent countless hours on the phone trying to get a dental procedure that was medically necessary for a sleep apnea diagnosis covered. And I was a bit out of practice because I hadn't been dealing with insurance companies and issues for a while. And I used to be a pretty staunch health insurance bulldog when it came right down to it. But, I was tired now. But I was able to get the procedure covered. We just have such a high deductible for an out-of-network provider who was the oral surgeon we went to that it didn't really matter. But it felt good to flex those healthcare bulldog insurance muscles again. Oh, well. Will we ever turn this part over to Grace entirely? I don't know. She's very tenacious and pretty darn persuasive when she gets going. So who knows? We want to have high expectations, right? She's able to research her own doctors. She's researched treatments. She's been able to make some medical decisions on her own, which brings us to legal aspects of decision-making. So as I said, decision-making becomes an issue when your young adult turns 18, because in the eyes of the law, they are now an adult. So suffice to say, it's a personal decision of each family So I'm not expressing views of parents helping parents, just my family. And as I mentioned, we do have a limited conservatorship for Grace. We got it when she turned 18. We felt and we still feel a certain level of comfort with this control, especially around medical issues. And this is not to say that Grace wouldn't be consulted and isn't consulted. But if we found ourselves in an emergency room, in an emergency situation, we'd want to be able to decide the care. I carry conservatorship papers in the car. I have pictures of them on my phone so that if anybody ever questions it, we have the documents right there. But it is essential for our family that we have a supported decision-making philosophy or mindset, so that Grace is definitely involved in the decisions about her health. So we have a supported decision-making mindset with a safety net of the conservatorship. So as many of you are probably aware, limited conservatorship is for people with intellectual and developmental disabilities, and the judge appoints a conservator to make decisions for that person, whether it be with education, medical, social, or other services that you can respond to in a crisis when needed, or even not in a crisis. Supported decision-making is a tool. It's not really a legal process. And it's where a person with a disability can have a circle of support. And these supporters can help the person with a disability make decisions and choices about their lives. It can be in any area, and it allows the person with a disability to not relinquish their legal right to make decisions about their lives. There are agreements that can be signed, and I have some resources, again, at the end of the presentation. You will be getting this presentation, just so you know, at the end of the recording. At the end of the, tomorrow, it gets sent out in an email. But the agreement can be revoked at any time. So there's no kind of legal agreement at all. A durable power of attorney, however, is a signed legal agreement where one person could name another person to make financial or other decisions on behalf of that person, as long as the power of attorney exists. And then an advanced healthcare directive is also known as a durable power of attorney for healthcare. And that allows a person to state in advance what they want to do about healthcare if they become unable to make their own healthcare decisions. So, sorry, I think I need a little water. We actually have an event coming up on April 23rd with attorney Stephen Dale, and he'll be discussing these legal aspects of decision-making and going into way more detail than I would be able to do. And of course, we saved the best topic for last, everyone's favorite, public benefits. And I want to touch on two things. So the world of public benefits is vast and deep, and I'm no expert on these by any means. I bring in experts to talk about these topics through our Connections California series. You probably know, if your loved one gets SSI, that they can usually get medical assistance, Medi-Cal, right, in California, Medicaid in the rest of the country, Medi-Cal in California, automatically. But a couple of things to touch on is that if your young adult is under 18 and they're getting SSI and Medi-Cal, when they turn 18, there will be an age 18 redetermination that's going to look at medical and non-medical eligibility again, because the adult eligibility for SSI differs a bit from the child eligibility. So what happens to this Medi-Cal? They may be able to keep it and they may not. It really just does depend. But I just wanted to raise the issue. So if you are in that situation, you're just going to be aware about it, and you're not, a deer in headlights when you get the age 18 redetermination notice, probably in snail mail. The other thing I wanted to talk about is when public benefits, SSI, which is a public benefit, can shift to SSDI, which is Social Security Disability Insurance, different from SSI. SSI is mean-based. Social Security Disability Insurance has to do with how much money has been put into the system from someone's working life. So there's a thing called SSDI with DAC benefit, disabled adult child benefit, which means that when a parent begins to draw on their own retirement, if the young adult or adult is eligible, they can get 1/2 of whatever the parent is receiving. And that doesn't mean the parent gives up a half. It's just in addition to what the parent gets. The person with the disability is able to get 1/2. Now, often the SSDI is more than SSI. And there are also other benefits that go along with having SSDI. I am not the expert to tell you about it. Again, at the end of this presentation are links to videos where we have experts who have recorded their presentations, and they live in our video library, so you'll be able to go and look at those. Why am I bringing it up now with healthcare? And it is because after 2 years of a person with a disability having SSDI with DAC, that person is able to get Medicare. And many people believe that Medicare is a better program than Medi-Cal. And then there is also a way to have Medicare be primary and Medi-Cal to be secondary. Now, this is not lived experience for me, so I don't know all the ins and outs of it yet. I watch these things, these presentations, and I learn something new every time. So as I said, I'm learning right along with you. But this is just something to be aware of. And as far as I know, those SSDI DAC benefits continue as long as the disability continues, which means the Medicare coverage would continue as well. So something that is good to know also is that there's a Medi-Cal dental and a Medi-Cal vision benefits. Again, this is for California. And we have links at the end of the presentation as well, so you can go and explore them if you would like. So where are we now? Grace, since we began this adventure 3 to 4 years ago, Grace is now going to several of her medical appointments with her self-determination staff, her program staff. She's in the self-determination program through the regional center, and she's not going with me. And this is including her annual, her ear cleaning with her ear, nose, and throat doctor, who she found on her own, a podiatrist, her optometrist, were just a few of the things she's gone to by herself. The staff just kind of supports her, and she pretty much runs the whole show. She's made some of her own appointments, and she's working on putting them in her phone calendar and actually keeping the appointment, which is huge. Follow through is huge. We've created a laminated card with medications, dosages, and frequencies. You know how when you go to the doctor, you sit there, and even though it's in the system, they'll ask you all over again, what are your medications? What are your dosages? So now she can just pull out the card and hand it to them, or actually talk to them about it. She's filling her own prescriptions and keeping on top of when to reorder them, which is great. That's something that's off my plate, although I do kind of like lend an ear every now and then and make sure we don't run out, but she's doing a really good job. And working on explaining her disability in 3 sentences or less, which is tough with Prader-Willi syndrome, but also very important to be able to explain that to a practitioner, especially if you've never met them before, if they're covering for somebody. It's really nice to be able to explain it. And the latest big decision that Grace made about her health was a decision not to have jaw surgery to address sleep apnea. And that's where all that insurance bulldog kind of came in when I was trying to get some of the procedure with the oral surgeon and orthodontist covered. Grace has come to keep a list of questions on her phone before she goes to a doctor, which is really great. It doesn't have to be one of those forms that I was showing you, as long as, there's some kind of, this is my plan for when I go to the doctor. And she's also writes down things she has to do. And when we came home from the oral surgeon, she said, because I'm a grown-up now, I'm going to call the orthodontist's office and I'm going to ask about using a water pick for my oral hygiene now that I have all this appliances in my mouth, because that's what a palatal expander does. It's a bunch of metal in your mouth. And she did. And she called the office, she got the okay, and then she researched water picks and she bought one with her own money. So sometimes things just work. And this last item here is we are working on a 1-page description for medical appointments. And if you are at all aware of the person-centered thinking or person-centered planning, that is where the one-page description comes from. We don't really call them one-page profiles anymore. You might have heard them called that before, but it did come out of the person-centered or person-driven planning world, and it's a one-sheet description which has at least 3 sections, and it talks about what people like and admire about me, which could describe a person's strengths or gifts or talents, what is important to me, and how best to support me. What is important for me would be another way of saying that. So you could have a one-page description for every aspect of your young adult's child's life. But because we're talking about transition to healthcare, let's talk about the healthcare one. So this is a woman who's an author, but she also has a daughter, Melissa. And this site right now, I would click on it, but I know that when I was checking the presentation before I was going to give it, their website is under maintenance. But I think it's a fairly big organization, so I don't think they're going away. But this is an article about why, I think her name is Leanne. Leanne thought that this was a good thing to do. This is the fillable PDF, again, when they come back online, and this is what this looks like. The real benefit in giving the medical provider some info on the adult or young adult, what's been going on with them health-wise, how they're feeling, what supports them, what they expect from this visit, what their issues might be. It's just a way to communicate this in advance to the provider so they have a little bit of knowledge when they walk into the room. So you could either give it to the nurse or the nurse practitioner, or, the doctor when they walk into the room, easy enough to skip, right? My mentor and teacher, Trudy Grable, if you know Parents Helping Parents, Trudy was there for over 30 years. You probably know her, but she is a person-centered planner extraordinaire, a person-centered thinker extraordinaire. And she shared in one of her sessions that I took with her that her daughter's medical one-page profile, it talks about how her daughter likes to have an ACE bandage wrap whenever she leaves any appointment. Doesn't matter what the appointment was. It's just that makes her happy. So on her medical one-page profile, one-page description, it says that. And so she leaves every appointment with an ACE bandage, and that makes her feel comfortable, supported, happy, and much more likely to go along with whatever is happening at the appointment. So there's real power to it. This is what those forms look like. If I could take you to the website, which I know I can't because I checked, and as I said, it's under maintenance, but it has this healthcare information sheet and then this PDF fillable if you wanted to use that. Life Course Tools also has, their version of a one-page description profile, also PDF fillable, so you could, access it at their site. And what I found is a lot of these tools that are in the healthy living have been integrated into the toolkits. So I expect we'll see a bit more of that as those last 3 toolkits get developed. So the point being, it's really helpful to involve your loved one in the way which they receive their medical care, in whatever way they can be involved. And you'll obviously be the best judge of that. So where are we going? We'd love to keep increasing Grace's responsibility for her healthcare as much as we can. Do I ever envision a time when I won't be involved? Probably not. But we'll keep seeing what she can do and can't do, because that will help her circle of support, both paid and unpaid folks who will be involved in Grace's life when we're gone, to give her the scaffolding she needs with her healthcare. So what have we learned? We've learned to think big, have high expectations, everyone's expectations, from birth on up, for everyone involved in a person with a disability's life, whatever team it might be, the primary adults, the caregivers, the service coordinators, the therapists, the educators, and we all need to make sure that baby, child, youth, young adult, that we're always asking them, What do you want in your life? And let's talk about how we can make that happen. What do you want at this medical appointment? And let's talk about how we can make that happen. It really could be about everything and anything in the person's life. And we want to have high expectations for them. There's a quote that I really like, and I'll read it. Everyone progresses to the highest level they are able to achieve if there is a clear expectation by those who matter to them that they should do so. And I'll read it again. Everyone progresses to the highest level they are able to achieve if there is a clear expectation by those who matter to them that they should do so. It's pretty profound. And I firmly believe that self-advocacy is a key to all of this, because how can someone get the help they need if they don't know how to ask for the help they need or what is the kind of help that they need? So they need to know themselves and they need to advocate for themselves. So in closing, I can say that it really feels good to let go and let grow. And that is a Trudy quote. I didn't make that up, and I give her total credit for that. Trudy Grable. And actually her website is also in the resources, which I'll go over. But I have to say, it was really scary when Grace ventured out to her first doctor's appointment on her own. And I stayed by my phone. I turned it on. I felt for sure I was going to get a call. Nothing. Everything went swimmingly. She did a wonderful job. And if you would have told me 10 years ago that she would be doing that, I'm not sure I would have believed you. In fact, I'm quite sure I would not have believed you. But there you have it. So you want more resources, do you? Okay, let's go. Anything in italics are going to be videos found in our video library. And these are links. Not in italics, it's either to a web page on a site or a web page on the PHP site, or someone else's website like Trudy Grable's Person-Centered Plans, or the Learning Community for Person-Centered Policies up in Oregon. It's a great training institution for person-centered planners and thinkers. And then more videos found at more pages. And then this is a one sheet about pediatric to adult healthcare with more resources. So yeah, as I said, I like resources. I like sharing resources, and this is going to be a resource-rich presentation. As promised, some supported decision-making resources and agreements. Again, note these forms are example only. Please consult with an attorney if you're going to use any of them. But again, remember, not a legal agreement and can be revoked at any time. And some public benefits resources. Same thing, italics are videos. The rest are websites, outside of PHP. That's this Medicare, Medi-Cal, Medi-Medi, and the Connections California sites where you can find a bunch more information and even more videos. Where you can find your Parent Training Information Center, as promised, you can click on this, go to Find Your Parent Center, click on your state, and this is the state of California. These are all the parent training information centers in California. Some of them cover a huge area. And then your family empowerment centers. This map is not quite up to date. There are 33 family empowerment centers now. So there is one with resource specialists waiting and ready to serve you. So with that, I will say thank you for attending this evening. I hope that you were able to get something out of it, and I'm happy to answer any of your questions now. Thanks.